Have you ever wondered what your HbA1c level should be? And does it change as you get older? Let's talk about this important health marker in simple terms that everyone can understand. The normal HbA1c range actually changes as we get older. For most healthy adults without diabetes, doctors generally say that a normal HbA1c is below 5.7%. But this standard doesn't apply the same way across all age groups. Here's how the normal ranges typically break down by age. For people in their 20s and 30s, 4.0% to 5.8%. For people in their 40s and 50s, 4.1% to 6.1%. For people 60 years and older, 4.4% to 6.5%. The above range is for healthy adults. People having diabetes may find it hard to get down to this range. If you have got to this range with diabetes, please comment how you did that.
Yes, HbA1c levels tend to increase with age, even in individuals without diabetes, according to the National Institutes of Health, or NIH.
This increase is often linked to age-related changes in glucose tolerance and red blood cell turnover, according to multiple sources. HbA1c, also called hemoglobin A1c, is a blood test that shows your average blood sugar levels over the past 2 to 3 months. It's like getting a report card for how well your body has been handling sugar. This test is super helpful for diagnosing diabetes and keeping track of how well diabetes treatment is working. This means that what's considered normal for a 30-year-old might be different from what's normal for a 70-year-old. In India, for example, the normal range chart shows below 18 years, 5.7%, 20 to 39 years, 6%, 40 to 59 years, 6.1%, 60 years and above, 6.5%. For people with diabetes, the targets are different. The American Diabetes Association recommends, for most adults with diabetes, below 7%. For children, teens, and young adults with diabetes, below 7.5%. For older adults with multiple health conditions, 8% or slightly higher might be appropriate. However, I personally do not agree with levels higher than 7%, even if you are over 70. My understanding is that these recommendations are based on trying to avoid dangerous low blood sugar events called hypoglycemia. People, when they are old, may lose the sense of hypoglycemia. They do not feel the symptoms. That could be dangerous. You might be wondering why these numbers change as we get older. There are several reasons for this age-related variation. As we age, our bodies undergo natural changes that affect how we process sugar. Insulin resistance tends to increase with age, making it harder for our bodies to maintain stable blood sugar levels. This happens even in people who don't have diabetes. Research has found that the relationship between age and HbA1c remains significant even after adjusting for factors like race, body mass index, waist size, and blood glucose levels. This suggests there's something about aging itself that affects HbA1c. Some possible explanations include decreased red blood cell turnover in older adults, which means red blood cells live longer and have more time to become glycated, with sugar attached. This naturally leads to higher HbA1c readings. Changes in enzyme activity, decreased membrane lipids, and increased cell fragility that come with aging can speed up the process of hemoglobin glycation. Many physiological parameters like tissue sensitivity to insulin, insulin receptor activity, and pancreatic function decrease with age, contributing to higher HbA1c levels. But it's important to know that not all research shows the same pattern. Some studies of people with diabetes have actually found a negative association between age and HbA1c, suggesting the relationship might be more complex than we think. This is an important question, especially for people managing diabetes. Hypoglycemia means low blood sugar, which can be dangerous and cause symptoms like shakiness, confusion, and even loss of consciousness. You may not get those symptoms if your nerves are damaged due to persistent high blood sugar over the year. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Traditionally, there has been a strong link between low HbA1c levels and increased risk of severe hypoglycemia. The thinking was simple. If your average blood sugar is lower, you're more likely to experience dangerous lows. Research has shown that for patients with HbA1c levels between 4.0% and 6.5%, every 0.5% increase in HbA1c actually reduced the risk of hypoglycemia requiring hospitalization. But when HbA1c was between 8.0% and 11.5%, Each 0.5% increase made hypoglycemia hospitalization more likely. This creates what researchers call a U-shaped relationship. One research found that patients with the lowest HbA1c levels, below 7.1%, spent about 25% of nighttime with blood sugar below 70, or 3.9 millimoles per liter, and 8% of time with levels below 50, or 2.8 millimoles per liter, which is dangerously low. Another interesting finding is that 24% of people with HbA1c below 7.0% experienced silent hypoglycemia, compared to 11% in those with higher HbA1c. See the video above for a video, Why Blood Sugar is Dangerously Low, 8 Diabetes Medications That Can Cause Hypoglycemia. Silent hypoglycemia is especially concerning because people don't feel the warning symptoms. The relationship between low HbA1c and severe hypoglycemia has been weakening over time. From 1995 to 2012, the relative risk for severe hypoglycemia per 1% HbA1c decrease declined from 1.28 to 1.05. This is likely due to better diabetes technologies, improved insulin, and better monitoring methods in developed countries. Modern continuous glucose monitoring systems have helped flatten this relationship, allowing people to achieve lower HbA1c levels with less hypoglycemia risk. This technology has changed the game for many people with diabetes. It's worth noting that hypoglycemia risk isn't just about HbA1c. It also depends on several factors. What medications are you taking? Insulin and sulfonylureas carry the highest risk. How long have you had diabetes? Whether you have hypoglycemia unawareness, not feeling low blood sugar symptoms, your overall health and other medical conditions. There are lots of medications which does not cause hypoglycemia or minimal hypoglycemia incidents. See the video in the above link, How to Prevent and Manage Hypoglycemia. Avoid serious complications of hypo. For older adults, the risk of hypoglycemia is especially important to consider. Falls, cognitive impairment, and other serious complications can result from low blood sugar in seniors. That's why doctors often set less strict HbA1c goals for older patients with multiple health conditions. Understanding your personal HbA1c target is crucial for balancing long-term health with day-to-day safety. Your doctor can help determine what's right for you based on your age, health status, and individual circumstances. The goal is finding that sweet spot where your blood sugar is well controlled enough to prevent diabetes complications, but not so tight that you're constantly at risk for dangerous lows. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.